Hi, we're doing some lip augmentation today, and we're doing a combination of procedures including a lip lift in the upper lip area as well as lip advancements, VUI advancements in the lower lips. I just wanted to show you kind of what we're planning. In the upper lips we're doing what they call a buffalo type of lip lift, and it's essentially an excision of the skin in this area, and people take essentially 3 to 5 millimeters in this area depending on how much you want to pull up the lips. And there are some calculations that you can do to estimate how much you want to pull up. I've determined that we're going to stay on the conservative side with him and take only 3 millimeters in this area, and essentially the effect is going to be to pull up the upper lip, shorten this distance, as well as increase the appearance of this red part of the lip a little bit more by taking away the extra skin to give that kind of an effect. And based on my theory in aesthetics, essentially this distance should be approximately 1 iris width. And that's when I talk about an iris width, I'm talking about the colored portion of the eye. That distance here should be ideally about an iris width. For the lower lips, we're going to do an advancement of his mucosa. We're going to advance these V's into the shape of a Y, and these mucosal segments are going to be advanced outward so that essentially it everts the lips to show more of the lip. And essentially what we're advancing is strictly the mucosa or the lining of the lip, and not the muscle. And that's going to essentially increase how much this is seen in the frontal view and give him more volume. Now, right now, how are you doing, sir?
Fine.
Right now, his lips are injected, so they're a little bit more fuller than what they were prior to the injections of the local anesthesia. And prior to doing that, the injections, his lips were quite thin, so we wanted to give some volume to his lips, upper and lower lip. And we're going to take some covering or muscle covering, essentially soft tissue, and we're going to take this tissue and advance it into the lips above and below to give more volume to his lips. And we're just going to make little tiny incisions here and here, about 1 centimeter from this corner, and we're going to advance some tissue through this area. And how are you doing, sir? You pretty comfortable?
Yeah.
Okay, great. Well, thank you very much.